Now I invite Dr. Artem to tell something about the role of augmented reality. Do you use Artem augmented reality in your practice?
Thank you, Mehmet. It's a pleasure to be invited to this session. I just might share my screen. I have some few slides for it for demonstration. Yeah.
Yeah.
Can you see it?
Yes.
Okay. So regarding augmented reality, I just want to say a few investigation in this way. So this actually the possibility to fuse digital technology and to project it to any virtual content to exoscope, as was very nice presented by Professor Costa, to microscope. But you know that's in point of view of number of publication, the mostly augmented reality was investigated in our especially in spine surgery and education purposes, of course, and in neuronavigation, and then vascular and brain tumors. So it's most popular investigation this way. Of course, being as mostly spine neurosurgeon and using the percutaneous and some kind of minimally invasive approach, it was also pointed that possibility to direct the resection, especially in the very small curvature, it's very attractive. And also the augmented reality, we used it to navigate the screw positioning, or for example, the interbody fusion. And in help of this way, we can because to reach the certain normal level of timing for the surgery limited for 60 minutes, you have to perform 60 surgeries in endoscopic spine neurosurgery. That's why it's really important. But finally, we use the combination virtual, augmented reality, and mixed reality when we project the spinal structure directly to the view of exoscope or endoscope. It's really helpful. For my opinion, it's more helpful when we instrument something, to perform instrumentation, especially this head mounting glasses. Sometimes we use it. And if we also use some model of the spine construction, LONCO, or in case of scoliotic deformity. But what I want to finish my short talk, that's of course all part of simulation training with possibility to view the combination of fusion of anatomic structure and a certain patient in the microscope or in the endoscope. It's very attraction. But finally, for example, in Stanford University, the doctors can be trained before the surgery and to perform all the surgery the day before, for example, using augmented reality. And finally, the question how situation will develop if the certain scenario wouldn't be performed during surgery. The question, if you always use the navigation when you're driving, sometimes when navigation doesn't work, and in Moscow, be sure it's not work at all. The people couldn't find the target, and they couldn't follow the existing scenario of the surgery. If bleeding, if the structure is not seenable, if navigation doesn't work. So my question for the Professor Haidara, which also could be have the opinion or other participants, what's their opinion regarding when the AR completely used for the whole scenario of the surgery? That's interesting point for discussion. Thank you.
Yes. Haidara, would you like to tell something? Haidara is with us.
Yes, Haidara, please unmute yourself.
Aderehime Haidara is one of the
I think his Wi-Fi is slow.
Okay.
Mehmet, can you answer that, please?
No, actually, I don't have that opportunity to use augmented reality, but I have some doubts about it. It must be evolved, improved for future applications, I think.
Okay, let's move on.
We have not much time, I think. We can come to the